Action.
All right, so I've never done a PowerPoint presentation in my life. This is my first time, so go easy on me. I'm presenting today about bariatric surgery and group psychotherapy as effective bimodal treatment for obesity. Okay, so obesity in America. This is a huge issue, especially in our country as opposed to other countries. What is obesity? Obesity is defined as being 20 to 30% over your ideal body weight. Morbid obesity is being 100 or more pounds overweight or over 40 BMI. And Annie was nice enough to volunteer herself to calculate a BMI. How tall are you?
I'm 5'5" inches.
And how much do you weigh?
122.8.
No.
We just do 123.
I was going to say 123.
Well, I just got whatever. Yeah. I got a whole technical shit going on.
So your BMI is 20.5, which is in the normal weight range. Overweight would be 25 to 29.9, and then an obese person would have a BMI of 30 or greater. According to the Center for Disease Control, 1 out of 3 Americans is considered obese. Obesity in America is being referred to as an epidemic. Epidemic meaning affecting or tending to affect a disproportionately large number of individuals within a population. I think that's pretty accurate. Obesity is the cause of a number of major health and psychological problems, such as hypertension, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, sleep apnea. A lot of overweight people have sleep apnea, which is where you stop breathing when you sleep and they have to get the CPAP machine. Respiratory problems, some types of cancer, breast, prostate, and colon, so all the most fun ones. Obesity is also associated with complications of pregnancy, menstrual irregularities, stress incontinence, and psychological disorders such as depression. People suffering from significant overweight often have to contend with a lifetime of significant comorbidities, social stigma, and a lower quality of life. These things tend to be associated with anxiety, low self-esteem, and depression. Obesity is the second leading cause of preventable death in America. 34 million Americans struggle with obesity every day. Weight loss surgery. Have you guys heard of weight loss surgery?
Mm-hmm.
Do you guys know anybody that's had weight loss surgery?
Yes.
I mean, besides me.
Yes.
You do?
Yeah.
Really? Who?
I have a coworker's ex-girlfriend, and then a woman that works at the Starbucks that I go to every day, and a couple clients that come in and work at the veterinary hospital, so we have a few.
Cool, yeah. Well, it's becoming a lot more popular, so I think people are starting to know people who know people who have weight loss surgery, or actually know people who have weight loss surgery, so that's cool to me. Weight loss surgery is also known as bariatric surgery, bariatric meaning relating to or specializing in the treatment of obesity. The American Society for Bariatric Surgery describes 2 basic approaches that weight loss surgery takes to achieve change. Restrictive procedure, I did that a little prematurely. Restrictive procedure that decreases food intake, or a malabsorptive procedure that alters digestion so that you're actually absorbing less of the calories that you're intaking. And then there are a number of surgeries that use a combination of the 2 methods. In the year 2000, about 36,700 Americans underwent some type of bariatric surgical procedure. And by 2007, more than 5 times as many, about 205,000 people had undergone such procedures. The most popular forms of weight loss surgery are gastric bypass and lap band. Gastric bypass has been performed since the 1960s, so it's usually the most well-known because it's the longest practiced. Lap band is still very new. It's only been practiced for about the last 20 years. It started in Australia. You have a question?
Yeah. So I was wondering, because I don't know restrictive and malabsorptive.
So which one of those is which? Because I've heard of both of those, but. Okay, so gastric bypass is actually a combination because they reroute your intestines to form a smaller stomach, but they also take out a large portion of the intestine, which is used to absorb the nutrients that you take in. So you're taking in less nutrients of everything that you eat, and you're eating a smaller amount. The drawback to gastric bypass is that by creating a smaller stomach with tissue, it stretches. It's stretchable. So if you constantly overeat, if you're a compulsive overeater, you can stretch your stomach out and regain your weight. And I'll talk about this more later. Lap band is restrictive. It's not malabsorptive. You absorb everything you take in, and it doesn't reroute anything within your body.
So how do you lose the weight? You're going to talk about that. Okay.
Yeah. It's coming. I'm building that.
I like it, yeah.
Okay, what is lap band surgery? I have a couple of resources here, if you guys want to pass them around. This one's from my surgery center, and it's basically a guide to success. I put a little post-it note here in the back with this tiny, tiny, tiny little paragraph on support groups. As you can see, it's not very well emphasized.
Yeah.
And then this is a book written by one of the nurses at my surgery center. It's really just a functional sort of nurse's guide to laparoscopic surgery, but it has a lot of good information in there. Neither of those really address support group or the psychological aspects of how surgery affects you. Yeah, and that's kind of a big topic in my presentation. Lap band surgery, also known as gastric banding. Implants an adjustable gastric band at the top of the stomach, reducing the stomach's capacity by creating a small pouch and inhibiting large amounts of food from coming in. So basically, this is my stomach right there. That's how much I can eat. If I drink water or like a smoothie or whatever, I can kind of shove it down faster, and a lot of people use that as a way to cheat and eat more food. A lot of other people cheat by using milkshakes and things. So you have to have a really strict diet in order to lose weight. It's really just a tool. It doesn't immediately make you lose weight unless you work with it. Let's see. It is adjustable, removable, and requires no cutting or rerouting of the patient's internal organs, which is a huge pro as compared to gastric bypass. A lot of people experience infection or leakage because when they're rerouting your intestines, they staple them back together, and any sort of minuscule leak can lead to huge internal infections, and a lot of people end up back in the hospital.
Do you know if one of them is lap band, does that tend to be more expensive than the?
I believe gastric bypass is more expensive because it requires a lot more surgery. This one, they just put the band on there, they sew this, which is the port, to the muscle. Right underneath your skin, and that's it, then you're done. It actually only takes about a half hour, and I think gastric bypass takes at least an hour.
And do they tell you what the major difference is that would make people choose the, because wouldn't you, I just feel like I want something that I could change my mind about, but is there more of a benefit to the other one, or?
Yeah, there are benefits for both of them. A lot of people elect for gastric bypass surgery because you lose weight a lot more quickly because it's malabsorptive, you're not taking in as many calories. But that comes with a lot of cons too. You're not getting all the vitamins that you need. People have to keep up with their vitamins for the rest of their life. A lot of people will reach their goal of however much weight they wanted to lose and keep going under it, where they can't control how much weight they're losing because they're not getting enough nutrients from what they eat. There's a lot of risks involved with gastric bypass, but a lot of people that are so severely overweight want to lose the weight so quickly that they go for the more extreme surgery.